My name is Dr. Jeffrey Gold. I am a family medicine physician in Salem, Massachusetts, and owner of Gold Direct Care. When I was in high school, my grandmother took very ill with dementia at a young age at 62. For a long time, I was kind of very angry at her primary care doctor because we all went to the same family physician and he just didn't seem to be as involved with her towards the end, and we felt, my family felt very alone in terms of how to navigate this system. In my perspective, is the major driver as to why there's so much dysfunction in the system is you have an imaginary third person in the exam room every time. When you have a third party pay for everything, which indirectly is really you paying it, the person who holds the purse string is the one that's in control, and that's neither the doctor or the patient. To describe what my job was like when I was employed, by a major hospital system in a primary care setting, everything is set up as a transaction. I thought my patients deserved better. I found myself getting angry at patients for bringing too many things up in an office visit because I didn't have time and had 3 people waiting in the waiting room. By doing the model of direct primary care, which is what we do here, the relationship is solely between the doctor and the patient, and we eliminate the third parties so that we can foster that and use insurance for what it was actually intended and created for, which is major, expensive medical situations. But it's not an affordability issue, and it's not just for super rich people. I would say I think that's the biggest misconception, which they probably, think is concierge medicine. And I have one guy who has been a longtime patient, and, people think they have to run every prescription that they get through insurance. And one of his specialists was giving him an inhaler that was costing him through his Medicare D, which is the Medicare drug plan, about 300 and something, for a 90-day supply. Or I asked him, I said, there's a generic equivalent that's just an inhaler rather than like a disc that with a GoodRx coupon was $125 for a 3-month supply. So literally the guy walked out, saving every quarter a couple $100, which kind of cancels out some of his membership. So I think there are things like that. Currently a family that I'm dealing with now, the dad has been pretty healthy, very active guy, and over the past week got pretty sick. The fact that I've been able to speak with the family, coordinate the care with the doctors in the hospitals, speak with the specialists, communicate with them. They have direct access to me. They know I know what's going on. I was able to go to the hospital and visit them the other day. I think the value in that is a hell of a lot more than $135 a month. Even though we don't accept or bill insurance as payment, insurance is important. I'm not going to fix your broken leg. I'm not going to take out your brain tumor. Those are things that you need specialty care for and use insurance for. But we help people shop for insurance as well. We can help employers, with their benefits plan and lowering their cost and improving the care for their employees. I mean, there's the opportunities that we have here to redesign this system are huge, but it takes a conversation and it takes people asking the hard questions of how do you do things differently. But we encourage people to at least reach out and learn more. My name is Dr. Jeffrey Gold. I'm a family medicine physician, and if you want to see how healthcare delivery can be done in the way that it should be done, used to be done, and can be done, come contact us. We're putting the care back in healthcare.